Hey YouTubers, welcome back to New Skin RN, where wound care is made simple. Now it's a Saturday, so I decided to give you casual vibes, hence no lab coat, and I hope you appreciate that. All right. So I'm going to continue talking about debridement. If you've been following me, you know that debridement is the removal of necrotic or dead tissue from a wound. So if you have a wound that looks like this, no, no, not on a good path. And the reason is because necrotic tissue serves as a harbor for bacteria. It allows bacteria to grow and flourish. And obviously, if you have a wound that's full of bacteria and unhealthy tissue, wound healing becomes very unlikely. And in fact, this is why debridement is such an important part of a care plan as it relates to wound management. Now, there are several ways in which to debride, and I did a video on one way called autolytic debridement. If you haven't checked it out, please do so, okay? But today I'm going to talk about chemical debridement. So when does chemical debridement come into play? Well, here's the thing about cleaning a wound in general. Sharp debridement, which is one of the quickest ways in which to address necrotic tissue, is not always feasible. So for instance, if you have a patient with bleeding tendencies or a patient that simply can't make it to a wound care center on a regular basis in order to get sharp debridements, then chemical debridement becomes helpful in managing necrotic tissue. So I'm going to talk about some of the most commonly used items for that. Let's first talk about Dakin's solution. If you look here, this is a picture of it. So Dakin's has been around for many years and it's a bleach type solution, so sodium hypochlorite. All right, and we tend to use Dakin's for wounds that are infected, heavily necrotic, foul smelling. So it can be good in that way. Here's some things to consider. Number one, Dakin's comes in several different strengths, but generally speaking, we tend to use the lowest strength possible. And the reason is because we're concerned about Dakin's, especially in higher strengths, and it affects on something called fibroblasts. Fibroblasts give way to granulation tissue, which is what we want in wound healing. We want good, healthy granulation tissue. So obviously, if we have a situation where we're concerned about a product's effects on fibroblasts, in this case, Dakin's, then we're going to be conservative and use the lowest strength possible. Besides using the lowest strength possible, we tend to use it for the shortest amount of time possible for that very reason. And so once the wound starts to transition from necrotic tissue, foul odor to a clean wound bed, which can take a couple of days, then we'll stop using Dakin's and consider something else. Now, Dakin's can be made, for instance, in a hospital setting by pharmacy, but the challenge is that it can become unstable very quickly. And so for that reason, one of the good things is that now there are commercially prepared versions of Dakin's on the market. All right, so again, looking at this picture, you'll see it's in a brown opaque bottle. Dakin's is light sensitive, and so in designing it this way, it allows it to be protected and have a longer shelf life, which is a good thing. Okay, so now we're going to move on to Vashe solution. And so here it is in a blue bottle. And Vashe is also good for heavily necrotic infected wounds, but it can also be used in a clean granular wound bed. And I encourage you to go to Vashe's website and learn more about that. It is flexible for that reason in how it's used, as arrogant as a Zoke. Bottom line is that Vashe solution can also be used for chemical debridement. And lastly, I'll talk about something called silver nitrate sticks. This can be very helpful for a situation called hypergranulation tissue, also known as proud flesh. Here is a picture. Now, you may be thinking, well, it's red, granular. What's the problem, right? So this actually is not a good thing, too much of a good thing, all right? And the reason is because you now have granulation tissue that has grown past the wound margins, and therefore it becomes difficult for the wound to contract down and close. Also, it turns out that one of the theories behind hypergranulation tissue is that it's caused by high bacterial counts. So the bottom line is that hypergranulation tissue is not healthy. So in order to debride that, they'll typically use silver nitrate sticks in order to address it. So it can be painful for some patients, and typically several sessions are required, and it needs to be done by a prescriber, someone who's been trained to use silver nitrate sticks. So those are just some things to keep in mind as it relates to this method of chemical debridement. Okay, and so there you have it. Dakin's, Vashe, silver nitrate sticks. 3 common ways in which we facilitate chemical debridement. I encourage you to leave comments. I'm interested to hear what you have to say. I'm so glad that you joined me today, and I hope you found this useful. New Skin RN, wound care made simple. Okay, see you next time. Bye bye.